You do your job, you do it to the best of your ability, and you have no one to refer to. You know this family has to go home, you know the stresses that they're under because they've told you, but there's nothing you can do. You're just supposed to forget, see the next child. And then that family comes back to you desperate. Your preschool's desperate, your schools are desperate.
And we need to know now, we need to know. Doctors are saying that because it's a mental issue, they can't deal with that. To get the girls fixed and just get that help with them. So it's
A conversation that began 14 months ago has now taken off.
My name's Lorraine Smythe. I'm in Warren, proud Kamilaroi lady. I come from Queensland, so yeah, it does come down a bit in New South Wales. Yeah, but yes, very proud. I live here because my hubby's from here, yeah, and the girls, they were born at the Nepean, so.
In the regional town of Warren, access to paediatric care felt out of reach.
All I wanted to know is whether they got ADD or ADHD, and no way I want my children, mentally unstable. I want them to be right, and this is the start, and they need a paediatrician here. They need the guidance. My children need the guidance, they need the help, and I want to be there to help them, so I know where I stand, what I can do to make sure they grow up properly, with a good head on their shoulders. But yeah, that's...
I mean, you're obviously an amazing advocate for your girls. Like, you're really
I've tried.
And you're really pushing for what they need.
Yes.
So many families can't do that.
Yeah.
The collaboration between Little Wings and the local health district allowing free transport for skilled paediatricians to regional communities, allowing access to care no matter where you live.
Hello, my name is Mary Iskander. I'm a paediatrician. I have worked in Sydney as a paediatrician for over 20 years. I also worked in the regional New South Wales for some time, and I loved the country, and this was my opportunity to come back to the country. So I'm enjoying it very much. What inspired me was the fact that we didn't have those services for our children in the country, and we did for our city kids. And I thought that was an area of inequity in health, and it would be unfair to have our children suffer because of their geographical location, whereby the services they would require from someone like myself would be so simple and so easy to deliver.
It's a lifeline that mum Lauren Hocking knows all too well.
There's nothing like a face-to-face appointment, and that's not something that's been available to us because of distance and time.
The Medical Wings Clinic will service 5 children each month, with almost 50 other children on a waiting list.
Every month that paediatrician will come out to Warren. Every month that paediatrician will see more and more children off the very long 48 number of children that are waiting on that waiting list.
In a statement, the Minister for Health, Ryan Park, said it's an invaluable service which traverses vast distances and connects kids to medical care.
Sometimes when you hear something, sometimes when someone tells you something, you can't unhear it, you can't unlearn it, and you have to take action. And Little Wings is all about that. We're about filling those gaps, we're about supporting people if we can. And this really fell directly into our remit, making sure that doctors could get from the city to the bush, to make sure country kids are not missing out on healthcare just because of where they live.
What we don't want for the bush is that services go up and down like a yo-yo. We want consistency. We want to make sure that people have the access to healthcare they need when they need it.
So boarding that plane today was a proud moment. Of course, our incredible paediatrician, Dr. Mary, on board her first Little Wings mission and greeted at the airport, but what felt like majority of the Warren community. And I think that just showed us how important this is, how much it meant to this community, to make sure that Warren kids matter, to make sure that kids from Warren, their voices are heard, their families are important, and they're treated as important citizens of our country. No child should be missing out of healthcare just because of where they live. And so Little Wings is really about rebalancing that inequity that exists in our healthcare system. Like it or not, that is the reality. We don't have the specialists in the regions. We don't have the hospitals, the equipment, we just don't have it. So if we can fly a doctor in and out in the same day, if we have the funding to do that consistently and sustainably for communities, why wouldn't we? This particular mission was funded by Ryan Park, the Health Minister of New South Wales. And look, it was a journey to get there. But the reality is the impact of these funds, they're undeniable. The impact is invaluable for communities. I think not only the healthcare, not only the assessment, not only receiving the care they need, but knowing they were heard, knowing that they're just as important as any other child, any other family, and making sure that every child has that opportunity to really thrive and reach their full potential. And Little Wings is a small but an important part of that. And we want to be part of the solution for healthcare. We want to be part of that voice. And look, ultimately, no one would need us. Ultimately, every child would have a local specialist in their town, a hospital that can care for them. That's the dream. But until that happens, Little Wings needs to exist. And we need our healthcare workers, we need our families to keep advocating, to keep pushing, to keep raising their voice, because when they do that, we have that power too. And together, we're untouchable.
And it's truly because of Little Wings that Dr. Mary Iskander, our wonderful paediatrician, can fly direct from Sydney to Warren to start monthly clinics today, face to face. Having a paediatrician locally enables a child to be fully assessed and then a plan in place for that child's future.